Hello, this video will explain your suprapubic catheter. Following your surgery, a suprapubic catheter will be placed through a small incision made in the skin above the pubic bone. The tube is inserted into the urinary bladder and is held in place with sutures. The suprapubic catheter serves as an alternate route for urine to empty from the bladder while healing of the urethra takes place, or while bladder function returns to normal following surgery. During the day, keep the catheter clamped. Prior to surgery, a urinary hat will be provided to you. Urinate in the hat every 2 to 3 hours. Using the numbers located on the side of the hat, measure the amount of urine voided. Locate your bladder diary that was given to you in your suprapubic catheter care instruction packet. On your bladder diary, under the title Amount Voided, this is where you will record how much you voided into the hat. For example, if the hat reads 75 cc's voided, this is how much you will write under Amount Voided. After voiding, unclamp the suprapubic catheter. Allow it to drain freely for 5 to 10 minutes. Keep the drainage bag lower than the level of the bladder to aid in effective emptying of urine from the bladder. After allowing the catheter to drain, reclamp the catheter. Using the numbers on the side of the catheter bag, measure the amount of urine. This is the amount of urine from the bladder after normal urination. It is called residual urine. Again, locate your bladder diary and record the residual amount. As shown by our example bladder diary log, someone who voided in a hat 75 cc's wrote under amount voided 75 cc's. Then, after looking at their catheter bag, they added 250 cc to residual amount. When the residual urine amount is less than 100 cc's after each normal void, you may be able to have the catheter removed. The removal of your catheter will occur in our office. Please do not remove the catheter yourself. Some people feel that the catheter bag is very heavy where the catheter inserts into the body. To relieve this discomfort, you may remove the catheter. To do so, you simply make sure the catheter is clamped and then roll back the rubber tubing. To reattach the tubing, moisten the tip of the tubing and twist the two ends back together. Another problem that some people commonly face is leaking from this site of the catheter. If you find that you are experiencing leaking from this portion of the catheter, simply twist this part of your catheter back together. As we begin to conclude this video, some important things to remember are: drink at least 8 to 12 glasses of water every day unless you are told otherwise. Keep the drainage bag at a lower level than your bladder. Wash your hands before and after handling the catheter. Avoid allowing the catheter bag to lie on its side on the floor. Hang the bag in an upright position at all times. If any of the following issues occur: fever, cloudy or bloody urine, strong odor of urine, plugged tubing in which no urine output occurs in 2 attempts of draining, sign of wound infection, redness, swelling, tenderness, heat, yellow, or drainage, or if your catheter becomes dislodged. If any of the following occur, please contact our office.